We've got two amazing people in the studio with us. Paul-AndreWilton, he's got a French name, he comes from Care International, his organisation does wonderful work. And Peter Salisbury, he's a boffin, an expert in Chatham House, where boffins operate. But he's actually been on the ground, he's been out in Yemen recently. Tell us what you saw in Yemen when you in your trip.
Well, Peter, I've been there a couple of times over the last year or so, to both the south and the north. And the problem that you have, first and foremost, is in parts of the country, incredible instability. You've got roads that have been knocked out by airstrikes, you've got bridges that have been knocked out by airstrikes, and you have a country into which not much trade is coming. So when you add all of that together, and the fact that Yemen, even before this war, was the poorest country in the Arab world, you do have a lot of the ingredients for the cocktail that is a humanitarian disaster.
What are you doing about it, Paul-Andre?
CARE is a humanitarian agency focusing in this instance on getting water and sanitation to people, helping people with their food needs, because we're talking about massive malnutrition rates, huge levels of suffering, and we're talking 18 million people in need of humanitarian assistance.
18 million?
18 out of 27 million. I mean, this is, on any level, it's a global disaster, but it is the world's single biggest humanitarian emergency right now, and we are talking in desperate need as at the highest levels of food insecurity. People are dying of malnutrition and disease, and we've seen cholera also break out. So really we're at a very acute stage of emergency need, and CARE, along with other DEC agencies, are trying day by day to get out there and rescue people and support them in whatever way we can.
What are the sort of difficulties you've been on the ground that CARE will be facing as it tries to go about its business of bringing help to people who, through no fault of their own, desperately need it?
You just have multiple problems. You have the fact that a lot of infrastructure has been knocked out, a lack of fuel. You have the problem that parts of the country are controlled by a multiplicity of different militias, different armed groups with different agendas. You've got people who've knocked out hospitals with airstrikes, aid convoys with airstrikes, so on and so forth. And you've got in places like Taiz, this city in the central west of Yemen, you've got basically the indiscriminate shelling of civilians. So when you
by all sides, isn't
by
it?
all sides,
yeah.
And when you take that patchwork, that tapestry, and you put it together, access is this huge problem. Just moving a truck with anything in it from point to point is a huge difficulty. I don't know if that matches with your experience, Paul.
No, absolutely. I mean, access is a challenge. I think the point is it's a conflict, so it's quite volatile. It changes. We are able to get into certain places, but we can't predict when we can get in, and so there are concerns about how we can program, but we are getting into, across our agencies, we're getting into every governorate. I think this is key. CARE is in 7 in the north and the south. But I think one thing that perhaps is less reported about this conflict is how it affects people in different ways, and particularly if you look at the impact on women and girls. This was already one of the worst places to be a woman in the world. It ranked dead last in the World Economic Forum Gender Gap Index out of 142 nations. So in comes this conflict, in comes this crisis, and things have got from bad to worse. And then we also see things like the widespread destruction of medical facilities, and when you've got pregnancies going up, just when people need it the most, those facilities aren't available. So real problems, but also there are real solutions that can be brought through, and some of the work that agencies are doing in terms of giving people some money so they can keep buying food for themselves and keep the economy going.
Now we've got a question from Sheila Bucknell. She's asking, I'll put it to you, Peter Salisbury, are we making a difference?
Certainly by donating to this appeal and donating to any humanitarian appeal, people are making a difference. But it has to be said that Yemen's humanitarian needs are huge. This is absolutely crucial. Yemen needs all the help it can get.
I'll just say, at the level of an individual agency working in communities, every pound that we raise, which gets matched through this appeal, gets spent on helping people day to day, real people in their real lives. It is a conflict-created crisis. That means that ultimately there needs to be a political solution to that crisis, and I think that's why a number of these agencies are also calling for governments to do their part. Like you're saying, it's not just money, we also need people to sit down and solve this.
Well, you're the boffin, you're the one with the brains, you're the chap from Chatham House. Why is it that the world is unable to sort it out?
First, this is a really complicated conflict. Normally when we hear about civil wars, we like to think about two different groups fighting each other. We like to hear about the good guys and the bad guys. And in Yemen at this point, we've got sort of multiple coalitions made up of uneasy alliances, people who've got into bed with each other because they have agendas themselves. So the first issue we have is, even though the UN is trying to get negotiations going between sort of the two top line groups, the guys on the ground don't necessarily report to them. The second issue you have is one that we've seen across the Middle East, which is the internationalization of the conflict. You're seeing regional actors playing a role in the conflict, but with a wider regional agenda. So the Yemen war for many people isn't just about Yemen.
One of the things that will resolve this is a political process that includes more than just armed groups. And one of the things that CARE's been able to do, and other agencies, women are not silent in this. They represented a quarter of the people who came out in 2011 to start the protest. They've been part of the national dialogue. They now need to be part of solving this crisis. And one of the things that has happened because...
What is the national dialogue?
Well, I mean, this is back to the politics, but
yeah.
Ultimately there's a civil conflict and people need to work out how they're going to resolve it. But as you said, there's a lot that the international community can do or stop doing in order to encourage that. But at root, we're also talking about a country that needs to resolve it for itself. And our teams are on the ground helping people through possibly the most difficult moment in their history.
This is a country which has had the most terrible times in the past. Awful civil wars. And you're saying it's worse than anything that's ever happened
I
before.
think that the scale of suffering now is something which is unprecedented. And that's why it's not just about talking about long-term solutions.
There's 27 million people in the Yemen. It's as big a country as Syria. The humanitarian crisis is every bit as great. Now there's another question from Bob Jennings. Does the DEC limit its field of action? Are funds available spread too thin?
I mean, I think the point is the DEC is made up of humanitarian actors. So it's not its own agency. It raises money because all of us as humanitarian actors come together and say we need to do this together. So our operations continue on the ground. So the money that we get will go towards more dignity kits for women who have fled the crisis and are now lead families so that they've got something that they can clean themselves with and clean their children with.
What does it contain?
Well, when your house is destroyed,
yeah.
all your possessions are gone, you flee with whatever you have in your bags. Dignity kits could include soap, water, washing bowls. It could include basic hygiene items for women so that they're not exposed and not suffering the stigma that might otherwise happen if they're completely destitute. So
yes, I was meeting when we went up to Sada in the north, families had fled and they fled from fighting and they'd gone from village to village. They were still being bombed. The husband had been killed and the mothers. They'd fled from their villages where they'd had lovely, secure, well, I don't like lovely, but they had secure lives.
No, we heard people talk about they had a good life. They might be poor, but they could welcome every morning is a statement I heard. And instead now they fear every morning. A third of the places we surveyed had lost any medical facilities. So people are really without any kind of medical support. During a conflict when people are injured, they've got shrapnel, potentially people are suffering different forms of mental illness because of the stress that they're under. There is tremendous need, and it's certain that every pound that we get will be put to good use to support people get the food they need, get the wash, get the water and sanitation help they need, and get the medical services through other DEC partner charities.
Peter Salisbury, any other points you're the man with the brains. Anything else to add?
I think the other thing sort of worth bearing in mind is that in terms of the bigger picture here, there are problems with the central bank in Yemen. So Yemen has basically run out of dollars. That's the very simple story. People are struggling to get dollars, and what that means is that a country that before the war depended on imports for 90% of its wheat and 100% of its rice, basic staples in day-to-day life, doesn't have the dollars with which to import that food.
Now we've got another humdinger of a question for Paul-Andre, which is from Ingrid Merkel. What have you got to say to inspire people suffering from aid fatigue?
There's no doubt that the world has got a number of crises now which seem insurmountable, but for the person who's suffering day to day, they just need some hope, some help, and the humanitarian agencies that we represent are there to give that. So every pound that you spend is a life changed. So we're not going to be able to solve everything in 5 minutes. We can't solve millions and millions of lives, but we can solve them one by one. And that's what I would say to people. Don't ignore this. Don't wait for somebody else to come along. Your support, your £5, your £10 will be a life changer for somebody on the ground.
Ingrid, I think that answers your question. Certainly melts my heart. Oh, here's my wallet. And I hope others will follow suit. Thank you very much, the Boffin from Chatham House. Thank you very much, Paul from CARE.